So today we're going to discuss the journey of reconstructive surgery, specifically breast reconstructive surgery, in context with the patient we have here. So she came to me in a different way than we usually see. She came to me after her bilateral mastectomies, and actually it was right after surgery, 2 weeks after surgery. She just had her drains pulled and said, "I'm ready." So here's how it typically works. Breast surgeons and we usually work pretty closely together. They'll tell me a patient's coming, or they'll come and say, "Hey, I'm getting a mastectomy this day." And I discuss their options with them, whether it be implant-based, meaning direct to implant, or tissue expander to implant reconstruction. We also discuss all their options because legally they have a right to know all their options and to have an appointment with a plastic surgeon prior to their mastectomy or after. We discuss tissue-based, including flap reconstruction, like from your tummy or your butt. Even though I don't do those reconstructions, I like to have the discussion with them, and then I can refer them to someone who does. But this patient, she came to me, she said, "I'm ready, and I want implants." So we waited for all the swelling to go down in the mastectomy flaps. And then approximately 3 months later, I saw her again. We did a preoperative visit, and we did a tissue expander, which is kind of a balloon that's filled with saline in surgery and after, and get you to the breast size you want to be. And I call this the Build-A-Boob workshop. So you can get to where you want to be. She had very large breasts, measuring 1,200 grams, if that means anything to anybody. And kind of the cc's of the implant kind of mirror that. So we filled her tissue expanders, which were placed under her muscles. Some people do under the muscles, some people do above the muscle. I did under the muscle, as she had had surgery already, and I felt like that was the safer thing to do. And she was immunocompromised from chemo and such like that. So I placed them under the muscle. We filled them ultimately to over 800 cc's, which is a pretty big implant. And when she was stable, we took her back to the operating room. Both were quick outpatient procedure, and placed 800 cc implants in there, some fat around the implant, and got rid of all the extra skin and tissue she had from the mastectomy flaps. And she is tickled pink. She's so happy. And you can see the results. Her next step would just be getting a tattoo of a nipple, maybe some more fat as the swelling goes down, if there's some rippling from the implant, but otherwise she's done.